think there are some ways that the future of MGUS can go. If screening is the way to go, then the future of MGUS is very different than if it isn't the way to go. If screening will be the way to go, MGUS will become a clinical staple. Then we have large clinics taking care of many people who have this precursor, and we're identifying people who have MGUS-related disorders like renal disease or something like that, but also following them and preventing myeloma and related disease. So if screening is the way to go, that will really change how MGUS looks in the clinic. If screening is not the way to go, and it remains to be seen whether that's the case, I think the future of MGUS is still evolving a lot. One of the things that we're looking into in the iStopMM study is how can we follow these people in the most efficient manner as possible? When should we do imaging? When should we do bone marrows? And can we make the follow-up as efficient as possible? And I think that's something that will happen in the coming years, is that through the work that we're doing and many others, improving prognostication and improving care for people with this precursor condition. Another thing which I think is important to mention is that myeloma and plasma cell disorders are a bit unusual for cancers in that we have a very clear precursor where we can watch people over time, or at least when we look back, watch how people develop an overt malignancy. And I think the future of MGUS from a research perspective is also looking into understanding what is it that leads to the development of MGUS in the first place, and more importantly, what is it that leads to the evolving, this progression of MGUS to overt disease. And if we can understand that, I think we really understand how myeloma comes to be. And with that, we may have some opportunities for prevention or even new treatments and improve outcomes for plasma cell disorders in general. So I think the future for MGUS is bright, and that's why I'm working on it.